Hello, good evening. My name is Dr. Trudy Ufondu of Snowspirations Global Health Solutions. Thank you so much and welcome to our evening YouTube live stream. Today's discussion is going to center on pregnancy loss. Pregnancy loss is a very heartbreaking development. Pregnancy loss is something that should be managed conservatively. When a pregnancy it's going differently from what we envisaged. If it's not properly handled, it can damage a relationship. Now, it's possible you've had this experience. It's possible you're still hurting. It's possible you're still going through your different stages of grief. I want to assure you that what you're feeling right now is not out of place. You're not going crazy. It's happened to a couple of people out there. So what I intend to do in the next few minutes is to walk the walk with you to help you to understand what actually happened and also to help you take the steps you need to take. So today we're going to look at what happens. What do you need to do? What do you need to know when a pregnancy fails? So thank you so much and welcome to today's event. And I'm actually going to start. You see, pregnancy loss may bring partners closer together, or it may actually throw severe strain in your relationship. So losing a baby, which is defined as unintended loss of your pregnancy. Now, there are two different classifications of pregnancy loss. When you lose your baby before 20 weeks, it's called miscarriage. When you lose your baby beyond 20 weeks, it's called stillbirth. Both of them are classified as pregnancy loss. It hurts so bad. Most pregnancy loss will happen in first trimester. Remember that pregnancy is divided into first trimester, second trimester, and third trimester. Now, when you have a loss of an ongoing pregnancy, it can affect men and women differently. Men and women frequently react differently to pregnancy loss. Although men typically may report similar grief initially, they tend to kind of talk about their feelings quickly and they tend to move beyond the emotional part of their loss very quickly compared to women. For women, it takes a lot of time before they can actually accept what happened to them. And it's not out of place. Women are the people that carry the baby in their womb. So when you're carrying your baby, you have a special relationship with your baby. The relationship a mother has with the baby is not the same relationship a father has with the baby, because the mother is someone that is actually living with this baby 24 hours. So women are more emotionally attached to pregnancy loss. Women are more embittered when you have miscarriage or stillbirth. Now, the fact women are more emotionally attached doesn't mean that men are not also at grief. Men grieve differently. So women might interpret this as men not being caring enough. And this is where you need to be careful in your relationship. You need to be careful when you have this tragedy happen so that it can, bind you guys together and you guys can present as a team. Men might sometimes respond by believing that women are too emotional when pregnancy loss is involved. That's not the right way to go about it. Now, as a couple, both of you will need to share your feelings and you need to lean on each other and glean from the experience and become stronger. Men should remember that women might feel the loss very deeply and might need more time. And women should also understand that in as much as men might not be showing the same emotions they are showing, they are also feeling the brunt. So men and women respond to pregnancy loss differently. Now, when your pregnancy fails, it means that pregnancy is no longer able to be carried to term. Term means 37 weeks. So any pregnancy that failed means the baby is no longer viable. And when the baby is no longer viable, a couple of things. We might pick it up with no heartbeat. We might not see a sign of development. We might see so many things clinically that can tell us that that baby is not viable. When that viability is at question, then that pregnancy has failed. Like I said, it's term miscarriage if it happens before 20 weeks. Then it's called stillbirth if it happens beyond 20 weeks. So the tiebreaker is what? 20 weeks. Now, what might be the likely things that can lead to early pregnancy failure? So most pregnancy failures will happen in first trimester. That's the first 3 months. Most times, we might not even be able to hunker down and say, this is the exact reason why we lost this pregnancy, especially if we've done everything right. But in most miscarriages, it's a problem to do with the chromosomes in the fetus. Now, remember that the chromosomes are the basic genetic unit you inherited from your two parents. Your mom will bring 23, your father will bring 23 to form a 46 complete set of chromosomes. Now, if we have any problems inside this baby developing in your womb, it might lead to what we call chromosomal abnormalities. So you might have too many of the chromosomes, or you might have fewer of the chromosomes you need as a baby to survive. If you have fewer or lesser, it can lead to problems. Now, in some women, they might be exposed to some toxins in the environment. The problem might be coming from the placenta. The problem might be coming from cervix. So some women might have what we call incompetent cervix. Now, the problem can also be coming from the womb. If you don't have adequate thickness of the womb, which is supposed to be maintained by progesterone, you might actually also have miscarriage. And the problem can also come from your partner's sperm. So it can come from any of the two couples involved. Now, what are the risk factors of having early pregnancy loss, which is called miscarriage or stillbirth? Number one, your age. So you tend to have more abnormal chromosomes when you are older. So most miscarriages are commoner among women older than 35. For this risk, and for this reason, the older you are, the more the likelihood you will have higher risk factor of having a pregnancy loss. Matter of fact, at age 45, your risk of having miscarriage is higher than at age 35. At age 35, your risk of having miscarriage or stillbirth is higher at age 25. So as you get older, you will have increased risk factor of having either miscarriage or stillbirth. Now, if you've had previous miscarriage, if you've had previous stillbirth, if you've had previous infant death, you also have a higher risk. So if you have previously had the loss of your baby in your first trimester, the possibility it might repeat itself is very high. Matter of fact, when you have had 3 consecutive pregnancy losses, that particular woman is classified as what? Very high risk because of recurrent miscarriage, or what we call habitual abortion. Now, there are a couple of other health issues that might also predispose you to have miscarriage. So some women might have high blood pressure if it's not controlled properly. Some women might have diabetes. Some women might have thyroid problems, or even polycystic ovarian syndrome. So if you have high blood pressure, diabetes, thyroid problems, or polycystic ovarian syndrome, we need to control it. Now, some women might also have problem with their immunity. So they might have autoimmune disorder. In autoimmune disorder, your body is attacking your body. So this can happen. Some women can also have infections like gonorrhea or Zika virus. Thank God we've eliminated that one. And it can also be due to hormonal problems. Now, your weight can also play a role. So if you're above 30 in your BMI or you're below 18.5, obesity and overweight and low BMI can lead to problem in pregnancy. Lifestyle, if you drink a lot of alcohol, if you smoke, consume a lot of caffeine, we've discovered that a couple of this might have an adverse effect in your pregnancy. Now, what happens when your pregnancy is not viable? 2 things. When the pregnancy is not viable, if it happens before 20 weeks, it's called miscarriage. If it's beyond 20 weeks, it's called stillbirth. Couple of things. Please, before you proceed to either going for evacuation or what we call D&C, dilatation or curettage, or before you proceed to taking any injection we give you, we must confirm that that pregnancy is no longer viable. How do we do this? You probably go for ultrasound. We see if we can get the heartbeat of the baby. If we confirm through a particular ultrasound, or the fact we no longer saw a sac, or we didn't pick up a heartbeat, please don't run with the first test. Always go for second opinion. In the past, we've actually had some women that their babies could have actually been okay, but they ran with the first one. The anxiety and everything, they went for evacuation earlier than they should. So please, Just like you should also check your pregnancy test before you go for any procedure in the womb. There are some women that might be scheduled to go for HSG without knowing that they are pregnant. You cannot be pregnant and you go for HSG. So anything that will affect the integrity of the vagina, the integrity of the cervix, the integrity of your womb or your tubes, please be mindful. Once you are pregnant, so many things changes. So it's important to understand right now that unfortunately, there is no available treatment for non-viable pregnancy. So when that baby is no longer growing, when that baby is no longer alive in your belly, unfortunately, there is no magic we can do to make sure that your baby lives. Now, how do you cope? In addition to making sure your physical recovery, which is very, very important. So acutely, when you've lost your baby, it's important you focus on your emotional healing, your psychological healing, your spiritual healing. So this is where a lot of people can come in to help you. Coping with pregnancy loss can take a big toll on you that if you're not careful, it can affect your mental health. So we've seen women that develop depression and they have suicidal tendency from just losing their baby. So give yourself time to grieve. Very, very important. This is the time to find a compassionate person to talk to. So that can be your partner, that might be a relative, that might be a friend, and that might be a therapist. The best therapist to talk to when you've had miscarriage is your doctor. Most doctors are very compassionate. Most doctors understand. Most of them are parents. They know what you're going through. So when you've had miscarriage, it's important to talk to someone that is very compassionate, not someone that will judge you, someone that will allow you to go through your emotions. So what are the realities of failed pregnancy? Pregnancy loss can strain or strengthen your relationship. After miscarriage or stillbirth, you need to grieve. It can be overwhelming, but you need to remember that you can be happy again. You may not truly get over it, which is a fact. Anytime you've had a loss of a baby, that baby lives in your heart. No two babies can replace each other. So make provisions for the babies you've lost. But remember that you need to move ahead so you can start completing your family. Now, acutely, immediately after your miscarriage, what are the things expected? Now, because when you lose your pregnancy, your hormones are still trying to fluctuate. They are still all over the place. They can change your mood. They can actually make you to feel more sad. Some people, if they are not careful, they can go into depression because of the fluctuating hormones. So it's not unusual to feel very sad, anger, depression, pissed off with everybody. It's not unusual to feel that your body failed you, especially if you've been looking for this baby for a long time. It's not unusual to feel guilty, to be wondering if you did something wrong. Now, let me tell you the truth. The possibility what you did led to your miscarriages are actually infinitesimal. That means it's almost negligible. So most miscarriages are not based on what you did or what you didn't do. It's just what it's going to happen and it's going to happen. So you might feel the temptation of reviewing your entire life, remembering what you did when we were younger. Whatever you did, you begin to find reasons to justify what happened. It's a normal feeling, but please avoid that temptation. It's easy to blame yourself. It's easy to blame your spouse. It's easy to blame your doctor and everybody, especially when you've had recent pregnancy failure, miscarriage or stillbirth. But guess what? Pregnancy loss rarely has anything to do with anything you did. So the people you mentioned classically might not contribute to the loss of the pregnancy. It was just a sad event that happened and it happened. Now, how do you face your daily life after you've had this miscarriage? Like I said, you might begin to feel intense anger. You might begin to see babies and pregnancy people all over the place, which might not be in reality. You might be watching TVs and the only thing you're seeing is baby shower invitations, or you're walking past the diaper aisle in the grocery shop. You just feel this intense anger. You might actually start feeling jealous of other pregnant women and other mothers of new babies, especially if they became pregnant easily. When you feel this, my sister, you're not going crazy. It's okay to feel pregnant, to feel jealous of other pregnant women. It's okay to see mothers of new babies and you begin to wonder, why not me? You are human. You are not a non-living thing. It's okay, but we need to know where to cut off the point. We need to know when to transition. So if you are having all these feelings, it's okay. It's part of your recovery. Now, what you need to do is to give yourself a grieving space. There are 5 stages of grief. You have to go through them. You might not go through them exactly the way I'm going to mention it, but at some point, you're going to be in denial. So initially, you won't believe that you actually had loss of this baby. Yesterday, I had a lady who unfortunately had what we call missed abortion. She didn't bleed, she didn't have pain, but unfortunately, there is no viability in her pregnancy. And it was after 2 weeks. They wanted her to go back for 2 weeks to check again. And up to present, she still didn't believe that her baby is no more. So that's called denial. It's okay to be in denial. It's a journey. Now you will feel anger at yourself, anger at your spouse, anger at the doctor, anger at your mom, anger at your boss. Everybody involved in your life, you'll be angry with them. It's also important to understand that bargaining is part of grieving. So you begin to tell God, but God, why not do this? Why not do that? You begin to, reason. You begin to find so many things you might not really make sense of. Is also part of your recovery. Some women, if care is not taken, they can go into depression. You can go into just brief period of depression. It's okay. So long as you have good support, you can survive it. Now, finally, when you've gone through all these emotions, you can recover and you accept. So acceptance is the last phase of losing your pregnancy. Now, this is where your family and friends may provide you comfort. Though, be careful. Some family and friends can also provide additional stress. Some can provide comfort and some can provide stress, especially if your family and friends are too religious. Let me use the example Nigeria. So there are some people that will see a woman that just, had a pregnancy loss. Instead of just keeping calm and watching what she wants to discuss, you go there and you start quoting the Bible. You start, telling her, don't worry, this is going to be okay. That's not the right thing to do. At that stage, you might be adding additional stress. So you might not be able to relate your feelings to your friends, to your spouse, to people you used to hang around. And they might say unintentional, hurtful things to you, which at that stage, you might not really see it as unintentional. You might actually think they came to mock you. They are all normal feelings. Now, if you feel that your family and friends are not supporting you the right way, you can seek for support. There are so many support mechanisms out there, but by any means possible, seek support. Now, I'm going to give you practicable tips on what you need to do. Number one, have a special place for your baby in your heart. So plan to honor your baby with a statue, with a pendant, with a jewelry, with a tree, with a special garden. Just have like a place you go to talk to your baby. If your baby got buried in a particular place, if some people might have the opportunity to actually, depending on when your baby died, you can actually have an opportunity to go to a particular place and you can interact with your baby. It happened to us. So before Zara, we actually had this experience. We have a place we kind of go to once in a while and we interact with our baby, which unfortunately didn't stay with us. But those babies live in our heart. So find a way to honor your baby. Keep a journal. Find a support group. Then take time off. Time off is what so many people don't take. They immediately want to rush back. You just had miscarriage. You just had stillbirth. It's not even up to one month. You've started worrying, oh, my period is not coming back, this, that. You begin to put a lot of stress on yourself. You need to recover physically. You need to recover emotionally. You need to recover psychologically and spiritually before you go again. Now, a couple of things you must do. You must make an appointment with your OBGYN immediately. Now, when you get there, it's important. They review, they investigate to see if they can discover the cause of the loss. The earlier we discover what might have led to that loss, the better for us, so we can see what we can do differently for subsequent pregnancies. Now, please get second opinion. Second opinion in medical practice is always good. Make sure your loss is confirmed medically. So before you go for evacuation or before you take those drugs, let's confirm that actually your pregnancy is no longer viable. When you're done with that, gradually think about healing. Healing is important. Now, remember to make your own decision based on informed consent, based on your understanding. Create the memories of your baby. I've already mentioned that. Now, take it easy. Go slow. Heal. Take good care of yourself. Taking good care of yourself is something you have to do. Nobody can take care of you better than you. Talk to your partner. Understand each other. Find commonalities. Find a way you guys can encourage each other. Like I already mentioned, keep your journal. Seek help from others. Now, finally, go to a support group. Then, above all, trust God. God is still good, even when you're going through this tough time. God is still God. God hasn't changed. Okay, so that's in a nutshell my presentation today on this very important topic. Now, I'm going to give us an opportunity to ask our questions. So the clinic is open. Please feel free to ask your questions and I'll provide you feedbacks. Okay? Thank you. How long should a couple wait before trying again? So there is no fixed time for waiting. What you need to do is to observe all the steps I mentioned. Book appointment with your OBGYN. Let's investigate. Let's understand what happened. Now, don't be in a hurry to quickly go back and start making love until we've discovered the likelihood of what could have led to that difficulty in losing your baby. It might be cervical incompetence, it might be hormonal, it might be infection, it might be structural problems. So we need to investigate. Until those investigations are done and we have a clearer pathway, please don't try to go about trying to become pregnant again. Because if we don't solve the problem that led to the previous miscarriages, you can actually have another miscarriage. Remembering that if you've had miscarriage, if you've had stillbirth in the past, the possibility you have another subsequent one is very high. So the fact you've had pregnancy loss in the past is already placed you at risk. So we must go easy. We must take time to understand. We must recover. We must be ready. You have to allow your body to come back. You have to start exercising again. You have to start eating good food. You have to start taking your prenatal multivitamin. You have to start avoiding alcohol. Some people can take to alcohol. It's not only men that can take to alcohol, to deal with their grief. So some women can take to alcohol. Remember, when you're taking alcohol, that's not the best time to become pregnant because alcohol can harm your baby. Some people can take to smoking marijuana and smoking, cigarette and stuff that can harm you. So take time to recover. Very important. How common is miscarriage? Very, very, very common. Matter of fact, if we take a sample of the whole women out there, in your lifetime, about 3 in 6 women would have had miscarriage. But guess what? Some women wouldn't even know they had miscarriage. So some of those delayed bleeding, heavy bleeding that came out in clots, might actually be miscarriage. So if you are not actively testing for pregnancy with urine pregnancy strip, your delay period that later came back very heavy might actually be miscarriage. So miscarriage is higher than what is reported. So it's very, very, very common. And miscarriages can happen to anybody. The fact miscarriage happened to you doesn't mean you did something wrong. Most miscarriages are just how the body reacts to things the body doesn't really like from chromosomal point of view. Okay, but it's common. Why do some women have recurrent miscarriages? So these are the things we need to investigate, right? Now, if we rule out the chromosomal problems, there are a couple of other advanced investigation we have to look at. Sometimes you need to check for autoimmune diseases. Sometimes you need to go for advanced check. Sometimes you need to look at the cervix to see if you have cervical incompetence. We need to look at your hormones. We need to look at the womb. We need to look at a couple of things that might contribute to you having recurrent miscarriages. The beautiful thing about having this whole investigation done, if we discover you have incompetent cervix, we're going to give you sacrilege. If we discover your hormone is not within the normal range, we're going to supplement your hormone. If we discover you have a particular infection like gonorrhea, we're going to treat gonorrhea. Gonorrhea is very, very easily treated with good antibiotics. You take care of it. So the ability to discover what could have led to the problem and fixing it will help us in preventing it in the future. Can miscarriages be prevented? Here is what we know. Most miscarriages, we cannot tell exactly what the problem is. Now, if you are having chromosomal abnormality, nobody can prevent that. It's going to happen. It's going to happen. Now, what we can do, if you've been having this, is to go for what we call pre-genetic counseling and pre-genetic testing. So prior to, especially for women that are going for ART, we can actually check ahead on time before we begin to do those embryo transfer. When we are doing this, we are actually ensuring that whatever we're going to put in there will have a chance to survive. Now, your modification of your lifestyle can help to mitigate the risk factors. So it's not completely something you can say, oh, once you do this, it's not going to happen. So it cannot completely be prevented. But the factors that can be prevented, when we address them, then we can prevent miscarriage. So if we discover that your miscarriage was because of an infection, if we treat those infections, if we discover that your miscarriage was because of fibroid, if we remove the fibroid, if we discover that your miscarriage was because of cervical incompetence, we give you saccharine. So depending on the likely things we found in the investigation, it can shape our approach in regards to prevention. Okay? What causes late miscarriage? They are all in the same categories. It can also be chromosomal problem. It can be cervical incompetence. It can be infections. It can be structural problems. It can be hormonal. It can be anything. So the same thing that can cause early miscarriage in early trimester, which majority of them are chromosomal problems, can also lead to late miscarriages. Remember the tiebreaker, 20 weeks. When you've had this loss before 20 weeks, it's called what? Miscarriage. When it happens beyond 20 weeks, it's called what? Stillbirth. But they are all failed pregnancies. They just happen to have different names, okay? What test should a woman do when she's had miscarriage or stillbirth? Comprehensive test. We're going to start with your blood. We collect your urine. We check the hormones. We check the womb. We check the contour. We do some other advanced investigations, which is beyond the scope of this class. So there are so many things we can do, depending on what we are thinking of. We have to rule out infection. We have to rule out the hormones. We have to look at the womb to see if there are a couple of things there. Like if we notice you have a bigger fibroid inside your cavity, we have to deal with them. So what we are going to do is dependent on what we are actually looking at based on your own history. Now, there are a couple of things we can change. We can change your age. So if you're older, knowing fully well that your possibility of having stillbirth or miscarriage is very high, what we are going to do is to manage you under high risk. So the fact you are already 35 years and above has placed your pregnancy as what? High risk. So we keep a closer eye on you and we make sure we keep regular checks on you to see that anything we notice, we can deal with them immediately. So this is where your ANC plays a big role. So all pregnant women are advised to register for their ANC on time. Okay? Does having recurrent miscarriages have any effect on the body of a woman? Both body of a woman's physical health, 100%. It does. Because guess what? Anytime you've had eventful outcome. So in medical practice, eventful outcome means a sad outcome. So anytime you've had miscarriage or stillbirth, something in you goes. And anytime you've had a baby, so many things go through your body. So you need to take time to recover them. So physically, yes. Emotionally, yes. Psychologically, yes. Spiritually, yes. And all these things can combine to have effect on your physical health. So it takes a lot of things to actually become pregnant. When that pregnancy ends on a very sad note, your body goes through a period of intense transformation and changes. And those changes can put a strain on your health, so you can develop depression, you can become hypertensive, you can become diabetic, some people can take to food, some people can begin to do so many other things they find comfort doing, which can predispose you to developing some chronic health condition. So the answer is what? Yes, it can affect your physical health when you've had recurrent miscarriage. It can mess with your mental health. It can do a lot of negative things in your life that if you're not careful, it will be difficult for you to recover. Okay? Does SGHS provide counseling services for couples who had pregnancy loss? 100%. So one of the things we do better in this group is the ability to counsel you. And how do we counsel? We share the knowledge with you. We allow you to change your attitude. We allow you to understand. We empower you to advocate for your baby. We empower you to know the things you look out for. So yes, we can counsel you. So depending on your age, your counseling is age dependent. Your counseling is basic history dependent. So depending on your medical history, depending on the outcome, your gynecological history, your counseling will be based on that. And when we are counseling you, we are going to give you options of what you need to do. So yes, we provide those counseling services. It's part of our packages. So if you're signing to be under me for 1 week, part of what you're going to get is answer to all your questions. If you're under me for 1 month, it's going to happen. If it's 3 months, it's going to happen. If it's 6 months, it's going to happen. Now, if you're in our ANC group in Telegram, it's a group consult. You will have an opportunity every day to interact with us for a window 2 windows. So within those 2 windows, as a pregnant woman, you show up in the clinic, you ask all your questions, we provide you feedbacks, we work with you for the whole 9 months. So there are so many incentives you can benefit from our group. So if you need to get informed about this, admin is going to set you up. And after that, you can follow through and make sure you get the best from the group. Okay? So thank you so much. Do we have any other question? If we don't have any other question, Ebenezer, please share the topic for tomorrow so we can transition. Remember, in our group, we have a big event this month, Gender Selection Super Masterclass. We understand some women want to have boys, some women want to have girls, some men want to have girls, some men want to have boys. This might be an opportunity you have been waiting for. Come, let's share our knowledge. Learn how you can succeed. It's actually possible for you to have a baby boy, for you to have a baby girl, for you to have twins, for you to have triplets, for you to have quadruplets. It's possible. Thank God for that ability to go the next mile, to help so many women to actualize their family. So you might have been having 20 years of infertility. You might have been thinking, oh, this is the end of the world for me. No, it's not the end of the world yet. So come, let's fellowship. Let's share our knowledge. Let's together rise above our infertility and in 2022 become parents exactly the way God planned it. So please, if you're interested in this Super Masterclass, follow the admin in our group, register, and when you've registered, make sure your partner will be in attendance. Okay, so thank you so much for coming this evening. If we don't have any other question, Kenneth and Ebenezer, thank you for coming. And our other guests, remember to subscribe. I'm not saying this to boast, but if there is any group where you can get every single thing you need, is in this group. Since 2015, we've been developing humongous library. There is no aspect of female health. There is no aspect of this beautiful reproductive system we haven't covered. Now, knowledge can change your life for good. When you acquire the right knowledge, you can defeat infertility. So when you subscribe, please take time to go through our previous videos. When you're done doing that, please click on the notification so we can give you advance notice whenever we are coming live so you can participate. Okay, so thank you so much. Ebenezer, please quickly share the topic for tomorrow. Tomorrow is Thursday in our group. Make sure you join Dr. Ndite for tomorrow. Then join me on Friday for our 40s Fridays. Okay, thank you so much. All right, so admin is sharing the links for the Super Masterclass for this month. So in our group, every month we bring out one topic. We deconstruct, we pieces the topic. We make sure that everybody understands the topic better. This month we are focusing on gender selection and family balancing. There is nothing wrong in wanting to have a baby boy. There is nothing wrong in wanting to have a baby girl. It's called variety. And there is nothing you can ask God and God will not do it for you. So we need to connect you to the right source so you can do it better, so the peace in your home can return. We understand some family will need to continue their bloodline. We understand that. So if you happen to find yourself in this category, there are a couple of things you can do to actualize this. Okay? All right. Ebenezer, do you have a topic for tomorrow? If you have the topic for tomorrow, please share the topic for tomorrow so we can go. Okay. Thank you so much for coming. We appreciate you. And please, guess what? When everything else fails, please pray, play, and practice. By playing, I mean make love 48 hourly. The biggest weapon, the biggest secret of all the testimonies you see in our group, it's these 3 P's. You can call me Triple Doctor, and you won't be wrong. We pray a lot. We play 48 hourly. Then we practice. Part of practicing is attending this upcoming gender selection Super Masterclass. My people, let me tell you the truth. You don't lose anything. Rather, you gain a lot. But when you show up, and anywhere you see prayers, you say amen. Anywhere we see proclamations, you claim them. But if you're not doing the work, my sister, you are going to delay yourself. And we don't want anybody delaying anybody. So please, make good use of the opportunity you have today. Decide in September 2021 that you will change the history of your family, that you will be the person that will change the setback in your family, that you have all your boys and your girls exactly God wanted them to be. Okay, so thank you for coming, and I'll see you guys tomorrow. We're going to share the topic for tomorrow. It's an everyday late evening broadcast for now. Hopefully, over time, we're going to find a reliable time that will work for everybody. Thank you for coming. I appreciate you guys. Enjoy the rest of your evening. And bye-bye for now.